Yes.
Very good evening to all. Welcome to second day of faculty development program on science of rehabilitation organized by Department of Physical Education or University and Spinex Global. On first day, we received good response from all the participants and we look forward to have your active participation throughout the 7 days. On day 1, Dr. Mari talked about Vasa concept, and today also she will share very important aspects of Vasa concept. So now, not taking much time, and I would like to invite Dr. Mary to start the presentation.
Good evening for everyone.
Hello, Dr. Mary.
Hey, thank you from everyone that you joined us yesterday, and today is nice to continue. Before we start, I would like to say thank you once again, and thank you to my teacher, Dr. Vasa, from all the things that she has taught me. And the first questions which I have in the through social media was that can I do thesis about Vasa concept? And I would like to say that this is a very good idea. Absolutely, you can do. And Dr. Vasa can mentor you, and we can mentor you from Finland. And of course, you will have your own mentor from your own university. And by reading the Vasa concept ebook, which you can find from brainstrokes.com page, you will get plenty ideas for your thesis. Ideas and titles are endless with Vasa concept. We are also open for all kind of research collaboration with universities and hospitals or some other places. In Finland, we are research oriented and we have a good research team. The head of our research team is a doctor of neuropsychology. So we are ready to do researches about Vasa concept and how Vasa concept affects on speech and neuropsychological skills, and of course balance and movements in lower and upper limbs. But we are ready when you are ready. Just keep in touch. And I did the slide from these questions, so we don't need to go through the same questions today. So is the Vasa concept good for degenerating diseases? And for those, Dr. Vasa recommends to enjoy life king size and eat medicines, but this might change from country to country. And I would like to remind you that when you have learned to do Vasa concept as a therapist, you can use Vasa concept postures and exercises for improving balance, reducing spasticity, and releasing contractures in therapy sessions. Every time when you think that is best for your client, you just need to think what is good amount of exercises for your patient. If your patient has degenerating disease, you need to they need to have time to enjoy their life. You need to think the whole picture. But on these lectures, we are concentrating on stroke patients. And yesterday, we had also a question that is Vasa concept good for PNS and is it good for polio patients? And the answer is same for both of those. That with Vasa concept postures and exercises, you can release contractures. And once again, the same reminder. Yeah, and then when we recommend to do Vasa concept, like I said yesterday, that we recommend Vasa concept always when there have been brain injury, like CP, stroke or TBI, and TBI meant traumatic brain injury. And also when patients have had spinal cord injury. And you can start to do Vasa concept from hospital bed after the stroke or injury or on chronic stroke state. The important is that you start. And what is Vasa concept? I try to answer this in a short form. Vasa concept is a revolutionary concept for rehabilitating brain injury patients. And I would like to remind you that this is concept, not a method. And you can see the difference when you have read these sentences. And by reading those sentences, you will understand that the learning is a longer process than learning a method. So now I give you some sentences to describe Vasa concept and stop for a moment and think, can you understand the whole point of these sentences? First one is, Vasa concept is to expand the boundaries of center of mass movement on the particle side of the spine. Maybe I take that second time. Think. Did you get everything what this means? Vasa concept is to expand the boundaries of the center of mass movement on the particle side of the spine. Because inside of these sentences is so much theory that it takes time to learn everything. I'm checking the chat in the meanwhile. That is someone saying something here on between. Okay, not yet, but let's see the second. Is there a connection between increased degrees of freedom from flaccidity and development of abnormal synergic grouping, passive tissue contracture, and spasticity following stroke? And this is the first page from Vasa Concept ebook. So I hope that everyone will find the ebook. So you will learn so much more by reading it. And you can find the ebook from brainstrokes.com. So now we are learning the concept. And after you have learned to think out of the box, and after you have experienced Vasa concept postures and exercises on your own body, and then on the patient's bodies, and you have seen the results. After those, you are ready for Vasa concept theory courses. Learning to do Vasa concept is easy, but learning to understand the whole concept takes time. And by this, I mean that learning to do Vasa concept is easy is the postures and exercises. They are easy because you can also tell the family how to do it. But as a therapist, you need to learn to understand the whole concept. And that takes time. But after this all, you will understand those sentences that I just showed you.